Tonight we have a Channel 4 News special on the issue that many of you have been worrying about, the spread of the coronavirus. There are many urgent questions. How deadly is it? How fast can it spread? What are the best precautions? Will we end up responding to it the way that China has done? And how prepared are we in Britain? Here are some of the answers. The coronavirus has come to Britain. Is it here to stay?
The situation will get worse before it gets better.
As authorities scramble to contain an outbreak.
People aren't learning on the job. This is an expected scenario.
Fear and frustration start to spread on this island.
So Public Health England have really got to step up.
Health workers warn that the NHS can't cope as experts fear it could become a pandemic.
And this virus is the one which probably concerns me the most of everything I've worked on.
We explore if Britain can cope if it gets worse.
People are trained to do this. This is part of their job.
The epicenter of the outbreak of the symptoms of fever, dry cough and shortness of breath.
Workers are under
How
huge
efficiently
pressure.
the virus spreads.
This is no longer just China's problem.
Wuhan is China's manufacturing powerhouse, its population bigger than London. So where is everybody? This is ground zero for the virus. In response, the Chinese government has kept 11 million people off the streets. With at least 65,000 cases and rising, authorities here are taking no chances. Holding areas and pop-up hospitals built in days from scratch to contain those infected. But these facilities and their doctors are feeling the strain. Cut off from the rest of the world, Wuhan's inhabitants are screened for infection and monitored to prevent the virus's spread. Those who can't or won't comply are made to. With residents ordered to stay inside, life here is empty and eerie. Ben Kavanagh has been documenting the shutdown.
Usually a very, very busy road, not for the foreseeable future. Let's go home.
The Irish teacher living in Wuhan at the time was evacuated with around 200 Britons. He left China quarantined, but not everyone has, and the rapid spread of the virus has alarmed experts.
This is the British flight.
Over just 2 months, the virus, officially termed COVID-19, has killed almost 1,400 people in China, with almost 65,000 confirmed cases worldwide. The only other deaths outside mainland China are in Hong Kong, the Philippines and Japan. It has spread to at least 25 countries across 5 continents, and in the UK, we now have 9 confirmed cases. Brighton in East Sussex, home to our first cluster. 5 cases were confirmed here this week, all infected by a so-called super spreader, a man called Steve Walsh. At least one of these cases is a doctor at County Oak Medical Centre. Another worked in A&E at Worthing Hospital. And the fact that they were infected outside China has authorities concerned.
The detection of this small number of cases could be the spark that becomes a bigger fire.
Dealing with this disease is a marathon, not a sprint. The situation will get worse before it gets better.
It's very important everybody should be confident. We're a great country, we've got a fantastic NHS, we've got fantastic doctors and advice, and they should simply take the advice of the NHS.
The Prime Minister may be sounding characteristically upbeat, but the World Health Organization is still very cautious, desperately seeking precise answers to very pertinent questions. What exactly is the mortality rate of this virus? How fast and how far can it spread? Are we facing another global pandemic? And are the eerie images of Wuhan under lockdown a glimpse of our future here in Britain?
Remember to use soap. It'll get the bug away from you. And then
Local journalist Emily Walker is about to launch into the school run. But this is no ordinary morning.
Why is it important to keep our hands nice and clean?
So we don't get the bug.
Yeah, shall we go give our hands a wash before we put our coats on? Yeah, okay.
A new virus from a distant country has spawned a new kind of fear and a dilemma. What to tell children and what not to tell them.
We've just had a message from the school this morning to say 2 families at the school have been told by public health to self-isolate.
Nice and wet all over?
They're advising us if we wish to keep our children off, it will be an authorised absence. All done?
It was quite hard to turn it off.
So obviously I've had a lot of messages from other parents this morning. Everybody's kind of freaking out about whether to send your kids in or not.
Her son's school is just over the road from the closed medical centre, and details about what to do are in short supply. Professor Samir Bagin, a Brighton councillor on the city's health board, is one of the few local officials prepared to go on the record in what feels like an information lockdown.
All I'm saying is Public Health England have got to step up, because they haven't. And actually I'm quoting the Health Secretary, who yesterday said there's an imminent danger to the public. And I'm saying if the Health Secretary is saying that, then Public Health England have really got to step up and be more open in their communications and their conversations with everybody.
Samir is arguing with the boss at the council about how much information should be made public.
I mean, this morning we hear that parents were being told that they don't have to send their kids to a particular school and they'll get authorised absences for that. Now that's crucial. We have to challenge Public Health England. They have actually mucked up big time here. All right. Okay, bye.
We're all in uncharted territory, and everyone is trying to work out the dividing line between precaution and panic.
Hi, it's Laurie from the Argus. Hi there, I've written up a story which doesn't identify your...
Emily Walker is starting her workday at the Argus, Brighton's local paper.
Hello, newsroom.
The journalists are trying to piece together details of a suspected case. As they make their calls, they discover that lack of clear advice from the authorities is upsetting residents.
We keep getting these parents from schools and patients from medical centres freaking out basically because they don't know whether to go to their doctors, to their school, whether they should be in contact with people or not.
With a potentially deadly virus on your doorstep, it's no surprise that people are concerned. Reports suggest that at least 8 out of the 9 cases in Britain have only mild symptoms. Public Health England state that you have to be within 2 meters of someone for 15 minutes in order to be at risk. So what should we be looking out for, and who should we be worried about?
Typically we see this virus causing a cough or shortness of breath, and because there's inflammation it can also cause a fever. So those are the characteristic symptoms that we're looking at. The most vulnerable people are people who have pre-existing health conditions. And we're still really looking to see how we can identify. There have been some reports that possibly people more in sort of middle to older age are more vulnerable to more severe symptoms.
For Britain, the next few weeks are crucial. How the virus spreads and how we respond could be a defining moment for us. We met one of the global experts on modelling the spread of a virus.
We're probably where Wuhan was at the beginning of December in terms of the sort of numbers of infections which have likely established themselves in the country. What we're seeing is a very severe tip of the iceberg in the official case numbers. Certainly what we know is there's been huge demand on medical care, a lot of pneumonias, but we think that really probably only represents 5% of cases or so.
Direct flights to and from Beijing and Shanghai have been cancelled. But a Chinese national became the 9th case in Britain. She developed symptoms shortly after landing at Heathrow. We surveyed 100 workers from Britain's airports about what's being done to keep the virus out. 87% told us that screening tests are not taking place on passengers arriving from countries with major outbreaks. Their conclusion, 96% believe that we're not keeping Britain's borders safe.
So the question is, how much infection has reached the country? We think it's probably 2-3 times what's actually been detected.
Are there any doubts in your mind that this is now a global pandemic?
Estimate we have at the moment is we're at the start of a global pandemic of a new respiratory virus.
We've tracked how 2 Chinese tourists created a cluster of new patients in Singapore. And these daily contacts can happen anywhere. A guided tour takes them to a jewellery shop. They talk to a few staff and sample medical oils. A saleswoman is infected, later her cleaner as well. Then a second saleswoman, her husband and their 6-month-old son. Then the tour guide and her husband. Then 2 more shopkeepers. 9 new cases after just a few minutes of souvenir shopping. And latest estimates suggest that 60% of the world's entire population could contract COVID-19 if it's not controlled. Do you think that the infection rate of 60% of the population, which has been suggested by some of your colleagues, is realistic for Britain?
Potentially, given we know a lot about how these sort of viruses spread, we have lots of data from past epidemics, from influenza, given how transmissible this virus appears to be, and the fact that at least all adults can be infected, we have much less data in children, then 60% is a reasonable figure for the epidemic size within the first 12 months or so. What we don't know at the moment is, of everybody infected, what proportion might die and what are the risk groups. Our best estimate at the moment is that maybe 1% of people who get infected might die.
And in a mortality rate of 1%, that's 400,000 people.
Potentially. I would emphasise that at the moment, putting numbers like 400,000 isn't necessarily helpful because we have so little information.
But it's not an absurd number.
It's not an absurd number. No.
Are we overreacting?
I would much prefer to be accused of overreacting than underreacting, let's put it that way. And this virus is the one which probably concerns me the most of everything I've worked on.
But not everyone is convinced by the scary numbers. Professor Sian Griffiths co-chaired the Hong Kong government's inquiry into the 2003 SARS epidemic.
That is an estimate, a top estimate. It doesn't mean 60% of the world's population are going to get the disease. The super spreader phenomenon is one that leads to difficulties in controlling the disease, as we saw with the case from Brighton.
The key question, if predictions come to pass, can our health service really cope? In Wuhan, they built 2 hospitals in under 2 weeks, housing over 2,000 patients. Elsewhere in China, the authorities used drones to make sure citizens wear face masks in public. So is this going to happen to us? We're nowhere near that yet. But at this playgroup in Brighton, despite the frantic cleaning...
But I probably am doing it a little bit more conscientiously today, must admit.
Parents are already avoiding notoriously germy crowds.
The numbers will be down.
It's up to the parents if they want to take the risk.
I think the numbers will be down. Part of me thought maybe we shouldn't have it today, but it is a good service. It's something that's for the mums, really.
Even these ladies are trying to adjust.
Normally we go on buses, and I'm not going on the bus. Well, I got this. It's not a mask, but when I went on the bus to Tunbridge Wells, I could put that right up, and there were 2 other people on the bus.
A moment of levity. But how do the frontline medical workers feel? We carried out an exclusive survey of over 500 frontline health workers. 96% told us that they believe the NHS isn't ready to deal with the major outbreak, and 93% believe there isn't enough protection for NHS staff on the front line. With 1,700 doctors infected in China, medical workers here may be right to worry. But how Britain has coped with previous health emergencies helps us to understand how it might handle a large-scale coronavirus outbreak now. This air ambulance crew threw themselves into the unknown in Salisbury when the deadly nerve agent Novichok was found there 2 years ago.
Yeah, roger, mate. We'll keep an eye.
For us, when we attended Salisbury and Amesbury, we didn't even have a clue that there was a nerve agent involved. And it's like, you know, when first responders now attend incidents where someone has got flu-like symptoms, again, they are going to be unaware if that is part of the coronavirus. I think early communication with the attending authorities is key, and for Public Health England and other bodies to be open and honest about what is going on and what the attending clinicians will expect, and if need be, to have blood tests, to have you know, adult conversations about how we will be in the future or how we will be at that time.
It's still too early to tell just how far and how wide this virus will spread. But with 2 frontline health workers already infected, the experts fear that we may be heading into the unknown. The coronavirus has reached our shores. We're told that we're on the brink of a global pandemic that, unchecked, could infect 60% of the planet. So is Britain ready? We're in Brighton, the epicenter of the virus in this country.
There's an email.
In the newsroom of the local paper, the Argus, Laurie has received a call from a person who may have caught the virus from another suspected case at work. They were sent home immediately and told to stay in isolation.
You've been in contact with someone who may have coronavirus? Okay. Were you escorted or? You're in a cab? Was the cab driver wearing a mask? You had a mask on.
The advice from the government for people who do develop symptoms is to stay inside and avoid contact with others. But this has clearly been missed by some. The first person diagnosed in London turned up at a hospital in an Uber. It's making taxi drivers nervous.
Yeah, of course, yeah, because it's quite dangerous thing, you know. It's spreading, especially in Brighton and Hove. I, work as an Uber driver, and I carry so many different people every day. So obviously, a bit anxious and worried, so I don't get it. That's why I'm wearing mask and protecting myself and also other people as well.
Now the virus is here, the focus is containment. It's believed it is spread via tiny droplets of saliva. So the principal advice, wash your hands a lot, not exactly cutting edge. We'll need something else.
Ah, okay. So what happens here?
So this is where we first start working on the vaccine. It's the beginning of the story. So Paul here has been working with the sequence and is introducing it into cells to check that it's expressed in the right way.
Professor Robin Shattuck's team at Imperial College London is working round the clock to make a vaccine.
We're really at the very beginning of the approach. What's exciting is that we've been able to probably move faster than we have before because technology has really changed since the SARS epidemic, for example. And so we've compressed that process of developing a candidate vaccine from a period of many months to a few weeks.
A few weeks?
Yeah.
So best case scenario, when is the earliest that we could have a vaccine?
Well, that's more challenging. So we've come up with a candidate within a few weeks, but it's now just started in animal testing. The next stage will be to move it to human studies, which we hope to be able to do in the next months. The earliest that any group in the world will get a vaccine available for the wider public would be early next year. We may see that there's a second wave as we come back into winter next year, and then we may well need a vaccine, particularly if we see global spread of this virus.
But in terms of the health and safety measures that people are adopting worldwide, face masks.
So the evidence for face masks in the general public is very limited. In fact, there's no evidence to show that they have any effect whatsoever.
So if masks don't work, how do we stop a deadly spread like in previous pandemics? Nothing has yet come close to the Spanish flu outbreak of 1918, which is estimated to have killed around 50 million people worldwide, with over 200,000 deaths in the UK. As for seasonal flu, 17,000 people have died each year on average in England in the last 5 years. But if estimates are correct, 23 times more could die of the coronavirus. We've already had more deaths globally than the 774 who died from SARS between 2002 and 2004.
The viruses which pose the greatest threat globally are the ones which are mild enough to be effectively transmitted around the world, and for the sort of measures which rely on isolating cases not to be terribly effective, but have a high enough mortality that the overall impact when the epidemic runs its course is high.
So can our healthcare system cope with what might be around the corner? Our exclusive survey of over 500 frontline NHS staff found that 88% believe there aren't adequate facilities, such as isolation areas, to cope with large numbers of suspected coronavirus cases. And 81% felt there has not been enough preparation for the coronavirus. They told us,
"I'm a pregnant GP. I'm genuinely scared.
Patients get unreliable, inconsistent and potentially dangerous advice from 111. High-risk patients are still being told to see their GP.
We're being drowned in demand. A patient rang because they had a cough and lived next door to a Chinese takeaway.
No briefing on masks. I've had to buy my own from Screwfix.
Nowhere to put patients in primary care other than shutting them in the toilet.
If there is a big outbreak of coronavirus patients who need a lot of care in hospital, there are going to have to be difficult choices made. We're going to have to think about what other things are going to need to be put back, what surgery can be postponed, what outpatient appointments can be cancelled. And those are going to be difficult decisions that we don't want to have to make. But the hospitals don't have the capacity because we've been stripped very much to the bone for the last few years.
We put the concerns from health workers to Public Health England. But aren't you alarmed by these numbers?
Of course. Those numbers are not where we will need to be. What I'm saying is that we are in very early stages at the moment of dealing with novel coronavirus. We are making sure there's advice constantly going out to hospitals across the country, the Chief Medical Officer, the Medical Director of NHS England and others, writing on a regular basis with updates to guidance. There are extensive plans across both the NHS, wider government systems, Public Health England and others to deal with whatever the eventuality may be. Now that eventuality in the reasonable worst case scenario is not without its challenges, and those challenges may be significant for the NHS, and it will be prepared and thinking about how to deal with those. So I don't think we can say that there won't be any difficulties if we do get into that scenario.
Should we be banning all direct flights from China and other affected areas?
Well, what we do is make sure that every flight that comes to the UK from an area where there's concern about infection, the passengers get information that the pilot has to declare before they land as to whether there's anybody with illness on the flight, and that there are announcements made on the flight, so that if anybody does return from China or one of the other countries of concern and they do get symptoms, then they phone us quickly and we can get them tested. That's the most important thing for us to do at this stage.
What haunts the scientists is whether this could become another global pandemic, like the Spanish flu of 1918, which killed perhaps as many as 50 million people worldwide. Now, the world is much better and faster these days at developing a vaccine, but it is also far more interconnected and mobile. Will the coronavirus force societies in Britain and elsewhere to behave in fundamentally different ways? Could we cope? Or are we all in danger of becoming Wuhan?